welcome. You're watching the Health Talk session by Yashoda Hospital. Technology has significantly changed over the past few decades, and thanks to improvements in engineering and computing. Among the recent novel technologies, MRI guided radiotherapy may hold the greatest potential to improve therapeutic gains of image guided radiotherapy. So in our today's episode, let's discuss about MR Linac, a powerful tool that has allowed for unprecedented precision in delivering radiation therapy treatments. I'm Dr. Lakshmi, and let's welcome Dr. Ravi Suman Reddy, Consultant Neuro and Spine Surgeon from Yashoda Hospitals. Welcome to the program, Doctor.
Hello, it's good to be back again on the Yashoda Health channel.
It is critical and crucial for medical field to constantly evolve and keep up with the technology to provide the best quality care for patients. So how do you perceive this in the field of neurosurgery, Doctor?
All of us know how medical science has evolved with the use of technology. And all fields have benefited in medicine, but I would say that neurosurgery has benefited the most. With the advent of advanced imaging systems, now we are able to see inside the human brain and the spine and be very well prepared before we go to surgery about our plan of action and how we can save the patient from all these deadly diseases. And I'm very proud to be associated with Yashoda Hospital. From the last 2 decades, we have been introducing state-of-art and the most advanced technology in neurosurgery in India, and sometimes even in the world. We have been one of the first adapters. If you look at the last 1 decade and a half, we were the first to introduce FFF radiosurgery, which is non-invasively treating brain and spine tumors which are less than 3 centimeters in size. We were the first in South India to introduce the MRI suite into the operation theatre, where we could stop the surgery in between, get an MRI, find out how much tumor we have removed, take back the patient and try to tailor our resections based on that. We also have been at the forefront in India, and we train a lot of even national institutes for intraoperative neuromonitoring and awake craniotomies. And in the same process, we are very happy that we have introduced for the first time the MR Linac machine, which is of very usefulness in treating brain and spine tumors in neurosurgery.
MR Linac, Yashoda Hospitals being the first in India to introduce this to patients. So do you consider this as technological breakthrough?
Absolutely. See, always the crux had been that how do you involve and get a superior imaging technology into a linear accelerator machine? We generally had initially the X-ray based screenings, and then we had the cone beam CT, but however it was not very, the clarity of image was always a concern. We used to subvert that with the fusion of the MR images onto the CT scan and then treat patients. But with the advent of the MR Linac, we have married the best of technologies with imaging as well as treatment in the form of getting a 1.5 Tesla MRI machine on board the linear accelerator machine, so that both coexist in the same machine and we are able to real time see what we are treating. And so that is a very, very big technological breakthrough.
So talking about MR Linac machine particularly, Doctor, what are the advantages of this machine specifically when compared to the conventional therapy?
As I've always told you, you treat something better if you visualize it. And that is the dictum in both the brain and spine. So complex skull based tumors which go along the crevices of the brain, once we do an MR imaging on board the MR Linac machine, and then we can contour it better and we can see the treatment better, and when we are treating real time also we can do these imaging sequences. So we are able to visualize the critical structures away from the tumor and we are able to treat better. Second thing is, we also adapt the treatment plans according to the differences which occur in the tumor on day-to-day treatments. Suppose like you're treating malignant brain tumors, and as the treatment progresses, if there is a shrinkage in the tumor, you can reduce your treatment plans so that the toxicity to the brain is reduced and the safety profile to the patient is increased. So we have something called the adaptive radiotherapy, which is occurring in these tumors, and very foremost it is helpful to us in treating benign brain tumors which are less than 3 centimeters in size, both in the brain and the spine, by using this advanced technology.
Undoubtedly, MRI has been the backbone for diagnostic radiology due to its superior imaging. But when we speak about MRI Linac, are there any challenges or limitations that we should be aware of?
It's an amazing technology, and the indications are increasing day to day. So as of now, we have been successfully in treating more than 30 brain and spine tumors on this. However, we would like to go on to the next level, that is treating functional ailments like Parkinson's disease, psychiatric illnesses, and for painful conditions like the thalamic syndromes and trigeminal neuralgia. So as we treat more and more patients, I think the indications will also increase, and more neurological illness patients can get benefited from this treatment. The complications, as such, radiosurgery complications were less, but with the MR Linac, because the safety is increased, because we are visualizing while treating, the risk to the patient in the form of the toxicity to the critical structures or the chances of developing edema post surgeries, post radiosurgeries is very less compared to the conventional treatments.
So MR Linac has created a paradigm shift in the surgical field within a short span. So what is the role of MR Linac in neurosurgery, doctor?
Basically, any tumor which we were doing stereotactic radiosurgery or stereotactic radiotherapy with the conventional machine is an ideal indication even for an MR machine. And basically, these are primary tumors which have not been operated before, and also a second subset of tumors are those where surgery has been done and we have not been able to completely resect them, and there is residual tumor. So earlier we were waiting and watching for them to grow in size and then operating them again, but then the risk of redo surgery with ICU stay, antibiotics and complications, morbidity and mortality is very high, because we are dealing with complex skull based tumors majority of times, which are ideal for radiosurgery. So nowadays these are the recurrent or the residual tumors. So these are the main indications where we can treat all these kind of tumors. Predominantly are skull based meningiomas, acoustic schwannomas, and pituitary adenomas, craniopharyngiomas, chordomas, and also some vascular malformations like the arteriovenous malformations which are in the critical areas like the motor strip or the sensory strip, and speech areas. Also now the latest evolving trend is also cavernous hemangiomas, which we are getting very good results with radiosurgery. Also a subset is the solitary and multiple metastasis. If the primary is under control, then these are also ideal indications. With the MR system we can visualize this metastasis much better, even the smaller size one, and we can treat multiple lesions. Earlier in the regular triple F radiosurgery we were about to do about 5, but with the MR Linac we can treat even 8 or 10 multiple lesions in the same sittings. So basically the efficacy is improved, the risks have decreased, and the quality of imaging has improved. So it's a win-win for both the doctor and also the patients.
So would that mean patients would require fewer cycles of radiation, resulting in fewer side effects when compared to conventional therapy, doctor?
Absolutely true, because whatever is the conventional treatment, because we were not able to visualize, we couldn't go increase the dose which is given to the tumor majority of times. So we used to hypofractionate more number of times. But with the MR Linac system, because our visualization is spot on, we can increase the dose to the tumor and reduce the number of sittings. So faster recovery, patient gets, the treatment days are reduced, he goes back to work quicker, and obviously less morbidity, as well as he doesn't need to take off from work for a long time when he undergoes these kind of high precision treatments.
So when do you think a patient can get back to functionality when getting treated with MR Linac, doctor?
That's the beauty of this treatment. I have had patients who come from work get treated, and then go back home, enjoy a movie with family members, go to a mall, do shopping. Basically, there's no restriction of normal activities when you're undergoing an MR Linac radiosurgery. You just walk in and walk out, and then your life goes on. There's no need to even take off unless you have the psychological factor that you're getting treated and I need to take a rest. But many of my patients, I advise them not to even take leave from work. Just alter the timings so that, like, if you're getting treated in the evenings, you can work in the morning times, or if you're getting treated in the mornings, you work in the evening times. No one even needs to know that you're undergoing treatment, because it's a bloodless, painless treatment. We don't even do any kind of head shaving, and nobody needs to know or even knows that you're undergoing the treatment unless you divulge the information to your family members or your colleagues at work and all. So it's in all ways it's an amazing technology. And earlier when I joined neurosurgery training way back in 1999, we didn't have this technology with us, and we only had to offer surgeries where we used to find lot of morbidity, and patient used to have long recovery times, go back to work after 2 to 3 months, and the complications of open surgery. Yes, open surgery is still the mainstay in majority of the tumors, but there are a definite subset of tumors where you don't need to undergo open surgery, and surgery or the scalpel is not the treatment for all kinds of brain tumors. Radiosurgery is here to stay, and we have more than 2 decades of experience with radiosurgery, and with the advent of MR Linac, we have improved our efficacy, improved our visualization, and reduced the risks and complications for these kind of patients. So I would say that in case you have a benign brain tumor, somebody advise you surgery, please look out for whether it is amenable to stereotactic radiosurgery, because you can avoid all complications and undergo a seamless treatment, and where you can be going to work as well as getting treated on the same day.
Undoubtedly, MR Linac has pushed the boundaries of what is possible in the medical field. So before ending this episode, doctor, what message you would like to give to patients who want to consider MR Linac for their treatment option?
I would say that be aware of all treatment modalities. Don't be afraid to ask questions to your treating doctor vis-a-vis availability of new technologies, because many times many hospitals may not have the technology and they may not give the options, and there are a lot of information which is available on the internet. And if you in case any of you has a benign brain tumor and you want to avoid surgery, we are always there for you to put forth queries to the Yashoda team or to us personally, and we are willing to clarify. And we are very proud to say that we have evolved as a department of neurosurgery in entire India. We are at the forefront of any latest technology which comes into neurosurgery, and we have the entire gamut of treatment, right from open invasive surgery to endoscopic surgeries to non-invasive surgeries of both the brain and the spine. Thank you.
So advances in technology has enabled to deliver radiation with high precision for the best possible outcome for patient in both medical and surgical field. So this brings us to the end of this episode. Hope this episode was informative on the topic MR Linac in radiosurgery, and don't forget to join us for the next week as well. Until then, take care and stay healthy. Thank you.